A select few hospitals across the country are able to use research trials for new medical technology.
Munson Medical Center is one of those hospitals with a cardiac research team. The research allows patients to try new technology that could ultimately be life-saving. 7 and 4's Melissa Smith has more in this month's Your Health Matters.
A leadless pacemaker is something that we've been looking for a number of years.
Dr. Brian Jaffe, a cardiologist here at Munson Medical Center, is talking about this device, a leadless pacemaker. Up until recently, most cardiac patients have been using a traditional model to help regulate their heartbeats.
The old style pacemaker has the logic circuits and the battery all inside the can, and the top would hook up to pacemaker leads. The advantage of all this is the pacemaker's out here where we can get at it, and the wires go through the vein system down to the heart. The disadvantage is that the wires, the pacemaker leads, are the weak link. They can cause narrowing, blockage, or injury of the vein system going down. They can become infected. They can break. They're constantly moving. The heart doesn't stop.
That concern led to the new model, or leadless pacemaker. It's currently in the phase 2 trial of research. That means the FDA still needs to approve its safety, but the benefits so far are pointing in the right direction.
It doesn't go through the vein system. And so if the patient is a dialysis patient who needs those veins for dialysis, has had obstructions, occlusions, blockages, or surgeries in the past, or is at increased infection rate, risk, or is very thin and it's hard to get pacemakers in here, or has something wrong with their chest wall and so they can't, for many different reasons, a leadless pacemaker is going to be the cat's pajamas. It's going to be a really great alternative.
Besides this cardiac advancement, Dr. Jaffe says there's also a tremendous benefit to having research trials.
This is one of those perks of being in a good research center, that we're able to get our hands on new technology for our patients, for access to new technology here.
Jan Betcher helped start the cardiac research team here at Munson about 8 years ago.
We started from no studies at all to as many as 20 studies. We have enrolled and put on study more than 700 patients in the past 8 years. Currently, we have about 350.
The Leadless Pacemaker Study is the one making headlines right now.
We actually have 7 patients enrolled now in the Leadless Pacemaker Study, and every single one that has been enrolled has really benefited from the device. There is so much, they feel so much better when they come back for their visits.
Having the access to research devices gives our patients a leg up on new technologies that can really help them. So it's a huge feather in the cap of the doctors here in the hospital and for the community, because it lets us get new technology, promising new technology, years before we could otherwise get access to it.
In Traverse City, Melissa Smith, 7 and 4 News.
Wow, there are currently 9 research trials going on at Munson Medical Center. That includes trials for heart stents, leg stents, and new medicine trials.
Besides Munson, the only other hospital in Michigan offering research trials is in Lansing. If you'd like to enroll in one of the trials, we've posted a link on our website, upnorthlive.com.